with InTouch this morning. Okay.
A serious topic that needs to be talked about here on this Sunday edition of InTouch. Glad you're with us as always. I'm Jeff Smith, along with Danielle Cisterino-Hajdu from ProMedica Toledo Children's Hospital. We want to talk to you about a serious topic today, that being suicide and depression. What you're going to find out over the next few minutes is, I think, going to shock a lot of you out there as far as comparing it with things that are contagious, like the flu. First and foremost, this has been in the news a lot the last week or so. Take a look. Quickly, Good Morning America talking about Rick Springfield. You and I, before you came out here today, we were talking on the phone about, this icon from the 80s who earlier this week talking about numerous times that he thought about taking his life and, in fact, had a noose ready to take his life. The next one that we want to focus on happened out West Coast, Washington State University. A backup quarterback does take his life. No idea what was going on there, what led up to this, but once again bringing it to our attention. And finally, back here in the Buckeye State, Stark County, Ohio. That is where they have had 6 kids, either post-grad or current students who have gone to that step of taking their life. Suicide prevention. We want to start off our discussion here with a couple of segments here. First and foremost, we're going to start with preventable versus treatable. Danielle, talk to us about that. Preventable, obviously, right?
Absolutely. And depression is one of the #1 risk factors for suicide, and depression, luckily, is treatable. One of the biggest impediments to that, though, is folks that feel like they can't talk about the fact that they're suffering with depression. And, of course, there's a difference between clinical depression and sadness. Everybody experiences sadness from time to time.
What is it that triggers in your mind to think, all right, I'm depressed, but versus I'm just sad?
Well, I'm just sad is, like I said, part of life. We all experience highs and lows, and there are times when things don't go our way or we experience a loss of a loved one. That's absolutely natural to be depressed in those situations. But when you just can't be happy about things, when it's pervasive and it's persistent and it lasts for longer periods. Yeah, you don't want to get out of bed. You don't want to do the things that you once enjoyed doing. That's a sign that you may need to talk to somebody and get some help.
Neglect of schoolwork, neglect of family, that kind of thing. Those are recognizable. In fact, this is one of those things. In fact, she's so kind to share with us some of the statistics we have seen over the years. The CDC putting out in 2014 some of the leading causes of death. I want you to look at this with our audience and tell me what you see out of this. Let's show people at home exactly what we're talking about. So 2014, they go back. They look at the leading causes of death. What stands out to you?
So first of all, the fact that it's from 2014 might sound like it's dated, but that's actually the most recent statistics that we have, because the CDC collects those over several years or a period of time, and then they release them typically every 3 to 4 years. So soon we'll be seeing differences, but this is the most current data we have right now. And what stands out to me is that it's the #2 cause of death, so sadly, and I think shockingly for many, for the ages 10 to 14, 15 to 24, and even 25 to 34.
I looked at this that you sent to us, and it started a conversation in our newsroom this past week, because if you go back just a year, we had Whittier Elementary here in the Toledo district that had 2 students who were within that age group that took their own life. And I think that hit hard, real hard last year.
Yeah, it absolutely did. And you know what? Our local data is reflecting national data, because when that happened, the CDC's statistics that had been released before this, 2014, said that suicide was the #3 cause of death for 10 to 14-year-olds. And when that happened, it was so tragic, and our community really felt it. But then these statistics come out nationally that say it's gone up to #2, and we see that here too, locally.
Let's get into our next subtopic, that being talking about specifically how you need to talk about it.
Absolutely. So stigma is a really big reason.
How so? What does that mean?
So stigma is when there's this negative meaning attached to a term or a phrase. And suicide, depression, those are so dismal, and people don't want to talk about them. And in fact, they think that if they do talk about them or say, hey, I'm struggling, that means there's something inherently wrong with them, or that they're damaged in some way. And that is not true. Depression affects the brain just like diabetes affects the kidneys or any other organ. And people, when they have diabetes, they take insulin, right? And they treat that. That's how depression should be viewed. And if we can reduce and treat and help people through depression to get treatment, then we're going to reduce suicide rates.
Is the onus on that person that's going through it, or is it a family member? Is it a friend who hears about it and then does nothing?
The onus is really on our society, if you ask me, and certainly those around the person who's suffering, because they should be looking for those signs. But as we see with some of these folks, they don't show signs, right? Outwardly, they look happy, but they could be suffering silently. We saw that with Robin Williams, right? Everybody thought he was the happiest person, and he was really struggling. So I think it really comes down to, yes, the people around them need to be asking questions, hey, you're not yourself, but also knowing that it's okay to come out.
The problem with that, and Robin Williams is a great example, but you take anyone, they have this persona when they are out and about. Yeah. But then you get them in those private moments where nobody's seeing what's going on, but some of those close to them, they are seeing it, aren't they?
They are, and they're afraid to probably ask a lot of times, not always, but don't be afraid to ask. Don't be afraid to come right out and say, what can I do for you? You're thinking about hurting yourself. People never come out and say that, but if that's what your gut's telling you, follow that. But that's why I go back to society, because we place this stigma on mental health, and we need to lift that. It doesn't mean, like I said, that there's anything wrong with the person. They were just born with something different, and it's treatable.
That hits on so many different topics as far as losing the stigma. Finally, our last subtopic, talking with Danielle here today, once again, suicide, depression in the news. You talk about it being contagious. We have talked for months about getting a flu shot because that's the concern. You're saying this is worse than the flu.
Well, it takes more lives, and sadly, the word contagious is a correct terminology that we use for that, because people who are struggling silently, again, because they don't feel like they can get help, when they see a suicide or a suicide close to them happens, it's a form of trauma they experience, and it puts them at much greater risk. So we see this in some school systems where if they have, for example, a student that takes their own life, then other students then follow. And so what we need to understand is that talking about suicide does not cause it, but when a suicide does happen, people around that person are at greater risk. And so in that regard, it is contagious.
In your work every day, I mean, are schools doing enough to get out the word, or is it a reactionary type goal?
I think most schools now are trying to be proactive and get ahead of this. But unfortunately, it hasn't always been that way. And so I guess it's a little bit of both, right? We've lost, one is too many, but we've lost too many children, we've lost too many people to this subject, and it is time to start talking about it.
Let's close things here today on InTouch, talking about if you do need help. There are easy-to-remember resources, aren't there?
911. I mean, when in doubt, always err on the side of caution, and if you think someone is not safe, stay with them, get them, if it's a child, a friend of theirs, a lot of times they will go to another friend to tell them they're struggling or thinking about doing that. Get them to a trusted adult, call 911. Like I said, err on the side of caution. Rescue Mental Health. There are so many great resources in the area. Harbor, ZEF, NAMI has support groups. So we have a lot of great mental health resources in this area.
Yeah. And talk about PEP.
PEP is a prevention program that's led by teens. And so it's all about, you know, kids getting involved with what they see and then tailoring messages to try to get this out, the word out, and prevent this from happening and say it's okay to talk about it. Yeah.
So no better place to hear it than from their peers.
I think so.
Danielle, great to see you. Thank you so much. Good conversation. You are now more in touch.
We'll do